All right, everybody, we're going to go ahead and get started as we still continue to have people enter. I am Maria Thacker-Gothi. I am Executive Director for the Georgia Global Health Alliance and CEO for the Center for Global Health Innovation, a new organization, nonprofit that was launched last year collaboratively with our global health partners across our community. I'm really excited about today's event. This is something we've been working towards with the Women in Global Health organization for the past 10, 12 months to get off the ground and really help launch a meaningful and a chapter here in the state of Georgia for women in global health. A few housekeeping items before we get started formally. First, just any questions that you have for our speakers today, please submit them in the Q&A section at the bottom of your screen. Do not put them in the chat. We will not be monitoring the chat for questions. We simply have too many people, which is a good problem to have. So again, please submit any questions in the chat, in the Q&A feature at the bottom of your screen. And not in the chat. And we will continue to remind you of this throughout the program. Finally, I do want to take a minute before I turn this over and get the show started to thank the wonderful volunteers that have stepped up over the last, say, 6 months to launch this chapter and get it off the ground. Let me take a moment and share all of their names. So just give me 1 second if you don't mind. Zoom makes me a little crazy. Hopefully the chat feature is no longer visible on your end. But I'd like to especially thank Rachel Clifford and Mahal Sadik. I'm so sorry, Mahal, and for stepping up and really helping to co-chair this effort, and all of these other wonderful volunteers for participating in virtual meetings and convenings and brainstorming together, and even having a wonderful December holiday, if you will, a few moments for a mental health break and just really bonding experience for these wonderful female leaders. So thank you to each and every one of you. Another thing that I know some people have submitted questions about during registration is, how do I become a member of Women in Global Health Georgia USA? That's really easy. First of all, you don't have to pay anything. Right now, we just invite you to go to that web link at the top of the screen here, and at the bottom of that screen, there is a form. Just enter your name, your email, and who you're with, and we'll get you added to that email list to start to get you engaged. And Rachel in a moment will tell you a bit more about our plans for the chapter, but I do encourage everyone to sign up at that link. I will drop that in the chat after I'm off the screen, and make sure you stay in the know about Women in Global Health in 2021 especially, as well as a number of other events that our partners throughout the entire Center for Global Health Innovation will be putting on this year. This is the first to, I think, a series of outstanding events and opportunities for our community and female leaders, as well as those who want to help empower and raise up, work towards gender equity, can really do and get engaged as we move forward. So with that, I am thrilled to hand this over to one of our fearless co-chairs, Dr. Hall Clifford. So Rachel, over to you, and I'm going to stop my share now.
Wonderful. Well, on behalf of my co-chair, Mahal Sadik, I am just so happy to welcome you here to our official launch of the Women in Global Health Georgia chapter. I'm Rachel Hall Clifford. I'm based at Emory University, and we're just so excited to be with you this afternoon. So thank you for joining us. While our group is too large to facilitate group introductions today, we would love it if everyone could take a moment now to drop an introduction to yourself in the chat box. That way you can get a sense of who's here and what our various kind of organizations and roles and interests might be. I would also like to give a huge thanks to Dr. Maria Thacker-Gothi and the Georgia Global Health Alliance for their leadership and support in getting this chapter off the ground. And again, to all of my amazing women on the leadership team who have really made this possible. So to think a little bit for just a moment as we begin our program today about Women in Global Health. Women in Global Health was founded in 2015 It's both an organization and a movement dedicated to achieving gender equality and global health leadership. All genders and allies are very welcome. Our Georgia chapter will provide opportunities for networking, skills building, and mentorship for women at all career phases in global health across Georgia and throughout the Southeast. So we really look forward to working with our members to shape events that are of interest to you all. And so we hope that you will take opportunities to follow up with this following this launch event to shape those. And we'll provide a little bit of information on upcoming opportunities at the close of our session today. So now it's my pleasure to introduce you to Dr. Roopa Dhatt, co-founder and executive director of Women in Global Health. Dr. Dhatt is a leading global voice for gender and health equity. She has held many leadership roles, including with Pathfinder International, Global Health Workforce Network, Global Health 50/50, and the Global Health Council. She's a busy lady. And Dr. Dhatt is also a practicing primary care physician in Washington, D.C. Dr. Dhatt, thank you so much for joining us today, and I'll hand over to you.
Great. Well, thank you, Rachel, for such a warm welcome. And thank you to Maria and Mala for just your leadership. This is the most exciting type of event that I like to join, where chapters are launching. It's a sign that the community and the movement, Women in Global Health, is growing. And it is how we're really going to bring the social change that we all want to see, where women are in leadership roles and there is truly gender equitable societies all around the world, but especially in our community in global health. And so as you already alluded to, Rachel, what inspired Women in Global Health in 2015 was very much when we take a look at the field of global health, there are so many talented women, especially women from diverse backgrounds. But when we take a look at the leadership pyramid, unfortunately, that pyramid has been fairly stagnant, with women representing less than 25% of the senior decision-making roles. And what we've seen, even when we take a look during these very challenging times of 2020, the pandemic, we know that women are particularly being less represented in leadership roles. And it's a really wonderful moment to be in a Women in Global Health chapter, where we can create a sense of community and share the incredible leadership journeys of women leaders. And so Women in Global Health, when we started in 2015, we had one really clear mission, which was to achieve gender equality in global health leadership. But since those 5 years of forming as a movement with over 25 chapters around the world, we have embraced a deeper commitment to looking at the issues of gender equity and global health leadership from a power and privilege lens. And so this past year, we launched a new strategy, which I'd love to share, a couple of preview aspects about, which are very relevant to the community here, is that our new mission is very much aligned with what we started the chapter model really for, is to start challenging power and privilege for gender equity and health. And that allows us to cover issues of women's leadership, but also deeper issues in the sector, particularly looking at discrimination, violence, gender pay gap issues, and also really expanding into continue to look at other aspects of how do we really transform the global health community and supporting women's movements as a core pillar. And so our strategy particularly is focusing on, in 2020 to 2025, there are 4 key pillars, and we call them first mobilizing. And as chapters, and all of you that are tuning in, I really do hope you take up Maria's challenge and sign up to become a member of the Women in Global Health chapter, and also go on to be part of the broader movement. We're hoping to mobilize 100,000 people over the next 5 years. And we say people because it includes women, men, and all allies from all genders, to really support the movement to achieve gender equality and global health leadership. We have another pillar, which is really focusing on advocating for change. So it's great if we connect with each other and get to know each other, but it really only has impact when we can actually advocate for social change. And particularly, we're looking to transform global health so that we see women in equal leadership roles at all levels of decision making, but also that we address some of the deeper issues on gender pay gap. Particularly the health sector has one of the highest pay gaps, around 29%, where you compare that to other sectors, which is around 20%. We also know that violence and sexual harassment are issues that we need to address in the health sector, and particularly for women working in the health and social workforce. So those are some of the deeper issues that we are really going to be pushing for, advocating for change. And in 2021, we're launching a campaign called Gender Equal Health Workforce, in line with the Generation Equality Forum that is taking place in June by the government of France. It is the 26th year anniversary of the Beijing Plus 25 Declaration on Women's Rights. And in spirit of that, we are launching this campaign where we are asking governments, but as well private sector, international NGOs, all groups really to think about how we can commit to transforming our health workforce and social workforce to be much more gender equitable. So that's one of our really exciting campaigns for advocating for change. We're looking to garner commitments as well. That's the third pillar. So not only do we want to build awareness and do advocacy around issues, we really want to make sure that's linked to action. And the fourth pillar, what we're calling hold leaders accountable. One of the great things about being in a community is that you can actually use the Women in Global Health name to bring visibility to issues, but you can also use the Women in Global Health name and platform to hold organizations and leaders to account when they don't follow up on the promises that they've said. And we obviously at Women in Global Health use a bridge building approach. So we know that transforming global health needs to happen in partnership. And so for us, that fourth pillar about holding leaders accountable, we really hope that all these global health organizations, which are our partners, are in the pillar with us, holding themselves accountable with us and really in partnership. And so our four-prong strategy that is for the next 5 years is really about challenging power and privilege, but really to ensure that this leads to not only gender equity, but better health equity overall and improves health outcomes. And what we're really excited about, especially in this next phase of growth for Women in Global Health, is we're committed to making sure that at least we have 50-50 representation from women from underrepresented backgrounds and lower middle income countries in our leadership roles in our board of directors. And also that as chapters form around the world, we'll be dedicated by having a team that is focused particularly on supporting chapters in lower middle income countries. And our target is by the end of the next 5 years, we'll have over 50 chapters and 70% of them from low middle income countries. So for us, you know, one of the great things when we have chapters that are joining from high income settings is that there really is an opportunity to support networks in any country that you currently do work in and to participate in chapters. And many of our members and founders of chapters find themselves not only a member of one chapter, but often several as their career takes them to different places, and they're often working across borders. So I'm really excited to welcome the Women in Global Health Georgia community. I really thank all of you. And please do stay in touch, as we would love to share more about our strategy and our exciting plans. And we want all of you engaged in this critical campaign that we're launching for 2021. And so on that note, I'm really excited to actually invite Dr. Schuchat to please join me. And you know, she does not need an introduction in Georgia, but in case others are tuning from around the world, she is a principal deputy director at CDC, and she is a trailblazer, woman leader in global health. And I am just so delighted to be able to join and chat with you, Anne, today. And I'm not going to introduce you. I'd rather have you introduce yourself, because it's just such an exciting career that you've had. So please, Anne, I turn it to you.
Thanks so much, Roopa. It's such a pleasure to join you today and to help with the launch of Georgia's chapter of Women in Global Health. Just a few words about me, particularly knowing that there's a lot of Atlanta friends and colleagues on here. Things you maybe don't know about me: I'm the fourth of 5 children. I'm a little sister. I have one older sister, and the rest are boys. My mom was an anthropologist, so the idea of global health probably was something I was thinking about from an early age. And from a young age, I wanted to be a physician, and ended up going that route, but came to CDC in 1988, before a lot of you were born. to join our disease detective program, the Epidemic Intelligence Service. And I've been at the CDC since then, working in infectious diseases, emergency response, global health, and special fondness for respiratory infections and vaccine preventable diseases. And as you said, right now I'm the deputy director here at CDC.
Great. And I love that personal, point that you said of how just, growing up, you were already primed to be in global health. And I can relate to that myself a lot. I actually took the pathway of becoming a physician. So I practiced clinical medicine. I'm a hospitalist internist here in the Washington, D.C. area, in addition to being the executive director for Women in Global Health. And my journey into global health was more so that I grew up with dualities. I was born in India and immigrated to the U.S. at a young age, but ended up being exposed to health inequities myself, being a patient while I was visiting my grandparents in one of the summers during my childhood. And it was just that stark contrast of what care looked like in India in the 1990s to what I could receive when I was back in the US. And at that time I was living in California, and just seeing how can we be part of one world and just see such wide spectrum disparities. And so I initially wanted to be a neurosurgeon, but my disclaimer is I'm not a neurosurgeon. I'm happily an internist, but I was very committed to working in health issues because of the health disparities. And that's what really, inspired me. And, Anne, looking at your, at the work that you do and the leadership roles you have, and I'm sure health disparities, especially with the pandemic year that we are, even though it is a new year, we're still dealing with the issues of being in a pandemic. It'd be great to get, your thoughts a little bit on, as we are looking at the challenge that that being in a pandemic takes personally, and especially for women. We know that women are not as represented in some of the decision making that's happening, their expertise, whether it is in academia or whether it is in the research community, even though they do exist. What are your thoughts on that? What are some, aspects that you've heard within your CDC community of how we can address the fact that women are facing so many barriers during a pandemic, especially women working in health and global health?
Yeah, thanks so much. I mean, there's a lot in that question. Obviously, the pandemic is just tragic and heartbreaking, and no person on earth has been spared really one direct or indirect effect. But it's been particularly hard in communities of color here in the U.S. and in lower income settings. Clearly, with so many children at home and not in school all around the world, it has devastating effects on the children, but also the family structure. And women in so many areas are both caregiver and healthcare worker and family decision maker, and sometimes the economic engine for families in a lot of communities. And yet their attention is often pulled in so many different directions. I think just personally in the midst of this pandemic, with so many Zoom sessions and so many of my colleagues working remotely, I have gotten a sense of the dual, the dogs and the kids and the phone ringing and the person at the door while they're trying to get, the critical work done of protecting Americans and working with our colleagues around the world. But it's really important for women to be at the table. And I've seen that both in this pandemic, but in one initiative after another. I was fortunate enough to be on the board of Gavi, the Global Vaccine Alliance, at the time when Mary Robinson, the former head of Ireland, was chair of the board. And she set a gender policy for the board that really set the stage that, this was not going to be one of those organizations that only had men or only had people from developed countries or only had people with certain experience. And I think that made that a stronger organization and stronger governance policy for the entity. But I think that decisions are made at every level right now. They're made at local, state, national, international, and women really need to be there when those decisions are being made.
Yeah, and just it sounded like, I think before we dive a little bit deeper into your answer, you also alluded to the fact that it's okay if, in the background there's kids and dogs running around, and it's a new norm, because I think many of us that are, wanting to, again, balance all those different roles and responsibilities, fear, do we seem unprofessional when we're, trying to balance it all in a pandemic? But it sounds like what you're saying is that no matter what level you are, there is a cultural change in being more accepting of the fact that we are all balancing different roles.
I think we take away from the artificial idea that our policies and guidance and issues, don't have impact. And when you understand the struggles that people have, so many people where you can't really, the kids who can't study because there's so many others in the household, and the circumstances for online learning or whatever are not there. Just the realities of the struggles are important for us to have when we're making decisions, and us to have when we try to figure out whether, for instance, at CDC, whether our guidance is real world proof, whether it's going to be actionable for whoever it's meant for.
And on that note, as you were saying, that having women at the table, and particularly women's perspective, have you noticed that when there are more balanced rooms, that we are then able to get more real life scenarios playing out? It'd be great to get, what have you seen in action as a result of having more balanced rooms? I'm sure you've been in rooms where it hasn't been gender balanced. In contrast,
first I want to say that my experience at CDC has been really positive in terms of the peers and the teams and the voices and the camaraderie. And I think when you're in the midst of a pandemic or of other emergency responses, to really feel like you can be heard, whatever level you're at, is important. There's clearly at the higher levels, it can be tricky. And certainly during this response, there have been a few times where I was in a setting where I was the only woman or one of two in a room of like 25 people. And I was shocked, because that rarely happens anymore. But there have been a few high-level rooms where that has happened this year. But I think the world is really changing, and that kind of environment for decision-making is just not okay anymore. But it really takes organizations like Women in Global Health to make that just not okay. That we really, we can do better in terms of the policies and the programs and the practice.
Great, and I agree with you. We definitely need to, as you said, still do a bit more to make sure that there aren't rooms that are, it's not okay. As you said, it's great to hear the change happening at CDC and it being a positive experience. We recently did a review of over 115 task teams from all around the world that are focused on the COVID-19 response, most of them scientific in nature or political advisory committees. And we found that 85% of them are majority men, with less than 5% having gender parity. So that just shows you that, there are many places in the world that we are still having a uphill battle and making sure women are at the decision making. And in your perspective, you had mentioned that having women's perspective is really important to the response, and you were touching a little bit upon that. If you were to be in that situation where you have to make a case to have a gender balanced room, what would you say? What are the main, top reasons it needs to be a gender balanced conversation from your perspective during a pandemic?
You want better decisions, and diversity of lived experience helps you get there. That, we've had there was a saying at CDC for a while that we don't want our guidance to promote eye rolling, that you don't want this to be just like ridiculous. And so I think when you have a diversity of perspectives, both gender as well as race, ethnicity, geography and income, you actually really factor more things in. In this response, we actually set up for the first time a chief health equity officer for the response, who reports to the incident manager and really looks across our efforts and makes sure that whether it's the investigations or the research or the surveillance or guidance, that we're really thinking from an equity framework. And it's really different when you think from an equity framework than you go where, where things are easy or where the data are complete. You realize that we need to do better. So I think, there's different experiences, and then there's also, there are definitely different styles. I think women tend to be more participatory and tend to listen more. I don't listen that well, so I have to, have that caveat, but people have to tell me, just let other people talk. But I think that there's a multitasking that a lot of women are used to. And then there's a collaborative spirit. It's not about the ego, it's not about the power, it's about getting the right things to happen. Lots of men are like that too, but they may not have that reinforced as they're growing up the way that a lot of girls and women do.
Great, and you're definitely, on point with that. That's a lot of the research that's been coming out, particularly in 2020, looking at governments headed by women, how they have performed better in COVID-19, and some of the communication style that's been used has been very much around collaborative. And in the spirit of that, what as an ED leading a global movement on women's leadership, and what we're really hoping to see is that now there is more opportunity for new types of leadership to be embraced. I think too often women's leadership has been labeled as soft leadership and not useful. But what we're seeing is that the pandemic is capturing that collaborative leadership style, and building public trust is so critical. Those two things are very linked. And so in your role, as you have been able to come across so many amazing women at CDC, are there a few examples of very inspirational women that you'd like to highlight with us? Starting off a new year, it's always great to have, inspiring stories just to, keep us energized. And so would love to hear about some of those spotlight moments from you.
Sure. I'll just mention a few names, and particularly I think for some of the CDC folks on I can't list everybody, but I was thinking, there's a few people that everybody hears about or sees, but there's a lot of folks behind the scenes that are just incredible. So one person I wanted to mention is Charlotte Kent, who's our managing editor of the MMWR, the Morbidity and Mortality Weekly Report. They have put out something like 190 issues, special issues, early releases about COVID-19 since the virus was identified last year. And these are developed by folks at CDC, folks in the field, folks in other countries, and go through a very rapid production cycle. So there are just, these things come in, proofs will come in at 10 at night and have to be returned by 8 in the morning. And they're really technical, scientific, complicated, very impactful. Charlotte has sought out individuals who had a good investigation that really needed a spotlight. She's navigated incredibly complex political and scientific territories, and she's really been tireless. And the number of times I've talked with her late at night or early in the morning and helped see where she was going, I've just been so impressed with her work on that. There's just a batch of people in the vaccine task force that are remarkable. I know everybody in the world has now heard of Nancy Masonier, who's been leading the vaccine work, but there are a couple others that I just wanted to mention besides Nancy, who really have been brilliant this year. We have Anita Patel, who is a pharmacist who, since the 2009 pandemic, has really been trying to figure out how we can do even better with vaccine delivery. And she's developed these partnerships and models and IT systems around pharmacy partnerships with the federal government that we're able to roll out delivery of vaccine to long-term care facilities, a place that really was going to be missed, and that are now expanding to other places. Another one of the champions within the vaccine world is Amanda Cohn, who's our chief medical officer for the vaccine task force, and is the lead for our advisory committee on immunization practices. And as a pediatrician and a mom of twins and everything, she's just been tireless this whole year in making sure that the best vaccine advice gets to the medical community and to the nation. So just a couple spotlights, maybe just two last spotlights would be.
Yeah, these are so wonderful women. We have to, you can keep going on. I love all these stories. Yes.
Well, the last two I would say are Barb Marston and Sarah Bennett, and there's many, many, many more, but Barb and Sarah are two of the co-leads for the International Task Force and have been, alternating leading that group. That's our group here in Atlanta that works with international partners, works with the CDC country offices around the world, with WHO, with researchers in other countries. And in this particular pandemic has really helped us try to learn from what's going on in countries around the world so that we can apply it here in the US and vice versa. The two of them are no stranger to our emergency responses. Both of them were heroic during the Ebola response. Barb as our probably longest running lead of one of the task forces during the West Africa Ebola response, and Sarah based in Sierra Leone pretty much for the whole time. So they both have field experience and Atlanta experience, but are really, you just wonder when they sleep. They're just amazing. That's a few. I mean, I could go on to like 50 more people, but there's so many stories of people who bring passion, humor, expertise, and just a real service commitment. So.
And thank you for sharing those examples. And as you said, it sounds like there's many more that we cannot recognize on today's call that do deserve the recognition, because as you said, women are working tirelessly. They're experts. They are able to carry on tasks that most people would not, imagine getting done. And I think that's really also, the important part about how we look and imagine, when we are challenging the stereotypes about women leaders in global health is, really showing the power that is out there, that there are talented women, and it's not that they don't exist, and that's why they deserve to be in leadership roles. And one of the, biggest fears that we are in our community of gender equality, and more so I think governments are looking at too, is that we see that, the pandemic can have a major impact on career development. It can have an impact on career. We're hearing more and more women going from full-time to part-time, or even going to arrangements where they don't have the same type of contracts. And we know that then limits what kind of opportunities one is able to get. So, what are some long-term effects that you guys are looking at the CDC when it comes to the COVID-19 pandemic, and particularly when it comes to careers and in global health? And if you have any tips of women that are trying to navigate this decision between full-time, part-time, or what can they do to create still an enabling environment for themselves?
Yeah, the pandemic is clearly just a transformative event. The impact has already been enormous, and it's still going. As a disruptor, life has changed. So many people go into global health because they like to travel, they like to be in different cultures, and they like to connect, and like to really make a difference. And the pandemic has literally grounded all of us, so people, wherever you live, it's not very easy to move around, and much of the global health work has been interrupted. Terrible impacts on immunization, on malaria, on you talked about domestic violence, and just mental health. There's so many health impacts, but the career impacts are sizable. In terms of while a lot of people in the professional categories are able to work remotely, the meaningfulness and the impact of remote work is quite different. And so I think people are making those big life decisions. Will there be opportunities when things improve, or really has what you wanted to do changed a lot now that you've reset your priorities? I guess at CDC, we're looking more at the health impacts than at sort of navigating careers. But what I would encourage people, whatever stage of your career, junior, thinking of that bright future, or senior people, use this as an opportunity to reflect and have some introspection about what's really important to you. What goals are you trying to achieve? Is the need to work in a particular field for impact, for satisfaction, for skills that you're trying to grow? And then how can you find that regardless of what economic or professional circumstances are at the other end? I'm usually very upbeat, and that's a little bit negative there. But I think the flip side is that the recognition of how interconnected we are, has never been greater. You know, what's happening in one country is affecting people in another country. What's happening in one city is affecting people in another place. And within our own communities, we are physically and literally dependent on each other. And so the case for investment in global health and for professionals with great expertise is growing. You know, it's been interesting in the US response that our global health experts here at CDC have been so critical for our field deployments in the US. You know, they are used to micro planning for vaccine responses because of the way mass measles campaigns work or polio eradication efforts work. They have great cross-cultural skills that are very important for our, you know, deployments to the meatpacking outbreaks or to the Navajo reservation. So I think that global to local case has really been made for public health in the US. You know, so much of what's just essential in global health work about community engagement and listening and getting the buy-in from the opinion leaders before you know, ram a new policy down somebody's throat. You know, those are just basic principles that we need to do everywhere that public health is being done. So I think the skills are valuable and applicable to different environments. You know, the challenge, you know, many of the global organizations have really retooled and focused here in the US. The Gates Foundation, you know, CARE and so forth have said, well, gosh, we have a big mission right here at home because of the toll that the virus is taking.
Yeah, and I really, it really resonated with me, the global to locals. When I was in medical school a little over a decade ago, and at that point we were trying to make a case to have a global health elective. And the administration was like, what do you want to do with global health? We have enough happening in Philadelphia, which is valid. There is enough going on. And we, you know, try to do a literature review and go to PubMed and, you know, find out all sorts of ways to make a case that, you know, actually global health exposure will strengthen our understanding of even public health locally. So, you know, what you're saying there, that the case has been made and that skill set is clearly very valuable and in great demand. So that's very, I think, promising for those that are worried about, you know, entering the field as new graduates. And on that note, you know, usually we do depend on, you know, face-to-face encounters to find mentors or build relationships or find new career opportunities, internships. What advice would you give in this, you know, digital era? How can people still continue to, you know, go through career development, find mentorship, when a lot of the sort of traditional routes of connecting with new people in global health is just not possible?
You know, one thing I would say is that, I mean, I'm always looking for silver linings, but a silver lining of the pandemic is that the older generation like me has gotten a whole lot more comfortable with the digital platforms. So I think I was, you know, supposed to be on some Zoom things about a year and a half ago and, you know, had no clue. And now it's like how we do everything. So I think the ability for people to have meaningful interactions remotely has increased because those are the only interactions most of us can have, you know. So that, you know, the mother of invention, basically. So I think we, you know, those, and I think there's just a huge surge at every level for connection. You know, that idea of meaningful contact with people has become more and more important. So I think for folks who are used to trying to reach out electronically to introduce themselves, you know, I think you still can go for it, whether the demands of the pandemic within our field are just so enormous. But that also means that there's a lot of opportunities for work and volunteers. And, you know, every state health department is increasing their staffing. The counties and the cities, you know, need more help. And you can start with an idea that I want to be working in global health. I want to have this kind of job 5 or 10 or 15 years from now. But, you know, working in a local health department or working in that state vaccine rollout or as a contact tracer is incredibly useful skills for future job experience. You know, sometimes you don't get that first job in the field of choice, but the first job can be something that gives you huge skills for subsequent ones. So I know quite a lot of the people at CDC who eventually spend their careers in global health started off as STD disease investigators, in local health departments before they got their sort of street cred and door-to-door cred and, being adaptable and figuring out how to be resourceful regardless of the circumstances, essentially being problem solvers. And that's really all that global health needs is problem solvers. So you can get that kind of experience in a lot of different ways.
And I couldn't agree with you anymore. It's exactly the advice I give to a lot of the early career women that come into Women in Global Health saying, we want to get involved. How do we get involved? And, there's really, in crisis, there's opportunity as well. And unfortunately, fortunately, that is the silver lining. And people are looking to still, mentor and sponsor because we are seeking that human connection. So I'd echo, this is the time to probably approach people you wouldn't otherwise approach and try to see how you can help and put the skills forward. And, if you're willing to just be adaptable and learn on the job, I think, you'll land easily somewhere else. And just kind of building on, long-term career advice, we focused a lot on what happened, or what is happening in the pandemic. And you've navigated a career over decades. And in that journey itself, if you could share a little bit more about that journey and some of the lessons that you've learned along the way, especially the ones which, are sometimes we don't like to acknowledge as failures, and when failures really end up leading to success in a way too. So Anne, if you could share some of those milestone moments in your career and some lessons that you've learned.
Sure. Yeah, a couple of things. First, a little story. In terms of the you were talking earlier about the sort of the who's in the room. So one of my first trips to Africa, I was all excited. I was being sent there as a CDC expert in a particular area, sent to this technical meeting, supposed to bring resources to help with the training and so forth. And the first day of the meeting, it was my first of a WHO kind of meeting in the field. They elected a chair and they selected a rapporteur, and the meeting was in French. I was the only non-native French speaker in the room, and I was the only woman in the room. So it was, about 15 people on this group, and they selected me as the rapporteur. And I was really offended. I'm sure it showed in my face, and I was really stressed out. I'm like, I'm supposed to take the minutes here in French. And, this is clearly because I'm the only woman in this room, and, this is secretarial work. And so another person from the meeting volunteered to help me and, to be my, partner in this, a lovely gentleman from Guinea, actually. And the two of us worked really closely, and we did all these minutes, and, everybody else was going out to dinner and stuff. And we were, into the wee hours working on these. And it was a wonderful experience working with this man. And what I learned through the course of working with him, and then later when I got back, was that the rapporteur is not a menial assignment. It's actually the power, because you get to decide, what's important, what isn't, and have that first draft of history in terms of the recommendations. And the second thing that I learned was that the person at the time, anyway, the person from CDC was always the rapporteur, because at that time we were like the only people with a laptop, so it was a long time ago. So it had nothing to do with my gender. It was totally, separate. But what I learned from that was, to be really embarrassed about how huffy I got and annoyed and pissed off. But I think the idea of just no assumptions, and, you can be your own worst enemy sometimes. And, that was one of those ones where, it was just a lovely friendship and collegial relationship that emerged from my being, sent off to have this assignment. The other thing that I would say is that I never I didn't get into this work to be a leader in it. I've always enjoyed being on a team, being part of a group, making things happen. I just love that in public health, you can't do anything by yourself, and that everything needs a team, and that whatever your role is, it's going to be useful. You can be of use. But that one thing led to another, and I ended up in these leadership positions often because people wanted me to apply or asked me to do these things. And I think in retrospect, what I didn't know was that leadership is really fun. And so I think there's a lot of people who don't want to go for the management job or don't want to be in charge. They just want to do the science, or they want to be hands-on, or don't give me those headaches. And I didn't know until I had to be a leader that the leader has a lot of great opportunities for impact. That if you're a leader, you actually can help set the tone for the environment, try to have a workplace that is, productive, collegial, possibly even fun, that you can that it's not the power and the ego, but it's the ability to really affect positive change. And so I find often wonderful people, many women in particular, don't want to be leaders. It may be more cultural that a lot of men want to be in charge, but by sort of being, randomly or forced or suggested for me to move up in the chain, I've just had incredible opportunities. So I would say, if you're starting off wanting to be a leader, figure out why. But if you think that you shouldn't, and that's not for you, think again, because we really need those egoless, talented people are often the best leaders and may not see themselves that way, but other people really benefit. The other thing I would just say, sometimes, and this might have been me earlier in my career, that sometimes you perceive that the leader has to be involved with conflicts, and that I don't want to deal with that. Let me stay away from conflicts. It is true that, when you're in a management or leadership position, conflicts emerge and you need to deal with them. It is so important to do the hard things first, to deal with the difficulties, whether it's a conflict or a challenge. Everyone needs you to do that. Sometimes the conflicts are a challenge for everybody, and everybody's been ignoring them. But recognizing that it might not be your style to dive into conflict, or definitely not your style to create conflict. But addressing conflicts is really problem solving, and problem solving is what public health is. So, people may think management, leadership, that's where all the headaches are. But, smoothing things out and taking care of those headaches is just such a service to the whole environment. So those are just a few thoughts about, whether to seek leadership or not, and then things you can run into along the way.
And I really like the framing you used, Ariane, that, in public health, we are trained to problem solve, and actually in leadership, conflict is a way of also doing public health service in a way too. So, and agree, there's a lot of, I think, floating myths around what leadership is. And in Women in Global Health, we say that, leadership is actually at all levels, and we can be leaders within our working groups, when we're trainees, and when we continue on to have more appointments and fancier titles. But, leadership really plays itself both individually, but collectively as a group too. So I think a lot of what you said really just echoes with a lot of our community. And one of the, I wanted to turn to the Q&A. We've had some really great questions come in, and I've tried to weave a few of those in. There's one which I think, Anne, you will probably resonate a lot with you, since you brought up mental health in your comments. And this is a question from Darlene Lynch, and she is raising the question that mental health is often seen as less scientific, softer area of global health. And although we know that the mental health consequences for global crisis impede recovery of people and communities, many mental health advocates and clinicians are women. How do we reframe the global health to focus on the care of the whole person, mind and body, and sort of challenge the aspect that focusing on mental health is less valuable in women's work?
Yeah, that's really important. I think that we've been, talking a lot about resilience, and, whether it's coping in the times of stress, or addressing the deep mental health issues that our populations have, you know, it's just essential. You know, I think we're concerned about what we're going to be seeing in the months and years ahead around the world in terms of the stressors that people have had and the way that people are responding to those. We know that a lot of suicide is not actually mental health origin, it's acute stressor and a reaction to that. And we couldn't have possibly had worse stressors than what we've been having this past year. So I think that, you know, the Carter Center is such a great example, and certainly Rosalind Carter as a champion for mental health and parity and elevating the issue as, you know, front and center and not an afterthought. But, you know, I think in almost every country I know of, there's a lot of work to do, whether it's for the treatment, the stigma, the recognition early, you know, I mean, every family has members who are suffering, and helping those members even admit or be recognized and linked with care. It's a hugely important issue. And I know it's one that is important to the incoming administration. I think some of you may know the former Surgeon General who's nominated for future Surgeon General, Vivek Murthy, has made a big, has been a champion really around mental health issues and resilience as well.
And just kind of taking that tail end of your answer there, agree mental health is incredibly important and shouldn't be seen separate to health. That's what I say as a physician, is that all my patients, their health includes mental health. It's not an add-on, and we need to operate in that mindset. And we are all thinking about change, and change, especially here in the United States, as there is new leadership starting in just a week from now, which is very, very exciting. And as there is change coming to the U.S. Multilateral landscape, and as well as to USAID and CDC, particularly with the new announcements, what are some of your hopes for the new strategic direction for global health in the U.S., with many of these appointments potentially being women leading, whether it is at UN ambassador role or other senior leadership roles at USAID, to name a few? Well, what are your hopes with this new change?
Yeah, I mean, I think that America's place in the world is always an important thing to consider, and I'm optimistic that where we've been retreating from the family of the global community will be more engaged. The issue of the World Health Organization and our participation, I think, we are so dependent on each other in terms of the world, and the U.S. being on its own is not a great thing. So I think that these are personal views, just that it will be helpful for us to re-engage, and for CDC, which really views itself as having sister agencies all around the world, that the more we work with individual countries as well as with multilateral organizations, the more we can, we'll all be better for it. But some of the biggest problems cannot be done with any one country, any one institution, and that perspective on the partnerships that we really need to promote are going to be vital. Clearly, the pandemic is one threat, but there's many other threats out there that we can't neglect, and whether they're environmental or other infectious disease threats, we need global collaboration to make positive change.
Great, and couldn't agree more with you, Anne, on that partnership is so important, especially in a field like global health. And as we come to the hour, we have so many great questions. Unfortunately, we haven't been able to get to all of your questions, but please, keep sending those questions in. I'm sure the team at Women in Global Health Georgia will be getting back and thinking about how we can integrate those questions into future programming. But Anne, the very final question I'd like to close with is asking you, what advice would you give to women aiming for leadership positions, and specifically for this community of women? What do you think are opportunities in Georgia for women interested in working in global health?
Yeah, well, Georgia is just it's gotten more and more amazing over, I've been here 32 years, and it's really a hub now for global health. It's not just the CDC, the universities all have really impressive global programs and partnerships, from undergraduates at, Agnes Scott with their global experience, I'm forgetting the name of it, to what Georgia Tech and Emory have with their global institutes, Georgia State as well. The NGOs that we have with CARE, with American Cancer Society, the Task Force for Global Health, there are really a lot of opportunities. So if you're a student in the town, there's lots of places to try to get an internship or summer job or volunteer. The networking opportunities are pretty big. Many of you may not know something that is sponsored out of Emory, but it's for really the whole Atlanta community, called the Vaccine Dinner Club. Hopefully when we resume physical gathering, but before that, once a month, they have a guest speaker, guest panels, and often on health topics around vaccines, but often globally focused, which are great networking opportunities and learning opportunities. So it's sort of taking advantage of the events that are happening like this. Certainly the next month's event would be a good one, but getting to know the people and looking for the opportunities where you can go a little deeper than just networking. For sure, Georgia is, signing people up to be contact tracers or to help with their vaccine program. And the CDC Foundation has also been expanding its ranks. It's our partner organization. So, this is a real growth area here in Georgia to get involved and make a difference. I think the issue with general advice I give to folks early in their career is really to try to be optimistic. It's, you may not, things may not be exactly how you want them to be, but usually there's an attitude that you can bring that can make the most of whatever the circumstances are. And I think if you find that you're bringing an upbeat and positive attitude, you're going to be more attractive for jobs and for promotions and for leadership opportunities, because being able to see the possible, see what we really can do when we work together is an attractive feature.
Great. Well, thank you, Anne, just for joining us and just all the advice and just having this, great candid conversation. It's a great way to start 2021. I'm just thrilled for the community here in Georgia and to have you be a part of it and just really welcome all of you to this. And I'd like to turn it back to Rachel to close out the session. And it's just want to say thank you, everyone, really for tuning in. And please join Women in Global Health Georgia and the broader movement. And we really are looking to transform global health so it's both more equitable and more diverse. So turning it to you, Rachel. Thank you.
Thank you both so much to Dr. Dhatt and Dr. Schuchat for this really fantastic conversation that we've had this afternoon. Just very quickly, our next event will be held in recognition of International Women's Day. Our event will be on March 9th at noon, focusing on COVID-19 and gender-based violence. We also have an upcoming spring event on global health policy and public affairs. And then we will be working towards our fall launch of the mentorship program. So lots of great activities and things coming up. So please hit the link that I popped in the chat to register as a member of Women in Global Health Georgia. And we really look forward to engaging with you as members into our future events. So thanks once again to everyone for joining us and to our two fabulous speakers for today.